Today we're doing AlloDerm grafting from 22 to 27, and you can see that she's got recession. She's got, I would say, adequate keratinized tissue. She's getting ready to do veneers here, and what we're going to try to do is cover some of the roots, try to get as much of this AlloDerm interdentally as possible so we can cover as much of the roots as we possibly can. Given that there's recession all the way into the mid-interproximal, it makes it difficult to do that, but we're going to try to get as much AlloDerm interproximally as we can. Okay, we're just going to plane these roots so we can prep the roots with a tetracycline paste.
Venenoso.
See it, scalar. This is a 2-week healing of the AlloDerm grafting, and you can see that there's some of the sutures are still there, and like for example in this area here you can see some of the residual cyanoacrylate. It's still kind of stuck in the sutures, and this is the spot where we put the Vicryl sutures on number 27. Things are looking really good here, but because the sutures are holding, I want to kind of leave them in, but because we have the cyanoacrylate kind of embedded in some of the suture, we're going to put the pack on again for another week. This is the 3-week healing of the AlloDerm grafting that we did from 22 to 27, and things look really good. We've got a good amount of root coverage. I didn't expect to get total root coverage in the 24-25 area, mostly because her CEJs are coronal to the CEJs of the other teeth, but then she's going to be having some veneers done in these areas, so we're going to wait a couple more months and then she can go ahead and do the restorative work. We'll see her in a couple months. Okay, this is the 3-month healing of the AlloDerm grafting from 22 to 27. Take a little closer look. The lower anteriors there at 24-25, there's a little bit of recession there, but what I note is that the gingival line is all even, and she's going to be having some cosmetic restorations, and we'll take a look at that after that's finished. These are the final restorations on the upper and lower anterior. And the lower anterior we did some grafting, and that was about a year ago, and the lower restorations are finished now.